7 o'clock. We do.
Thank you very much. Good evening, everyone. It's nice to be face to face, even though I've got the echo. Right. Have we got any apologies apart from the chair and Councillor Stubbs?
I'm not aware of any other apologies, Chair, unless there's any from the room.
Thank you. Right. Any declarations of interest? No? Okay. We'll go to the agenda of Monday, the 1st of March, for the minutes. Can I pass them? Or is there anything anybody would like to comment on? Okay. I will go to tonight's agenda in that case, which is page antisocial behaviour, which is our, the cabinet update. We've got one, please. There isn't one? Okay. Antisocial behaviour update. Is that over to you, Jill? Thank you.
Good evening. I'm Councillor Jill Heesom. I'm the portfolio holder for Community Safety and Wellbeing. The paper, the paper has been prepared by your officers at the request of the Scrutiny Committee to provide an update on ASB-related demand and activity over the past 12 months. In particular, the report highlights demand to service with high-level stats of antisocial behaviour reporting during the period by the Locality Action Partnership areas. The report also highlights other issues in relation to ASB in section 4 that members may wish to explore further with the officers in attendance. Natalie Noon and Sarah Moore are in attendance. I'll hand over to them now.
Thank you. Can everyone hear me? This is a different way of doing things, so hopefully everyone can hear me. There's not a great deal else to add to Councillor Heesom's introduction. Hopefully you've all had a chance to peruse the report in your own time. Hopefully it covers the kind of content that you'd asked for from the following meeting. We'd be very happy to take any questions or observations as we go. It's a different way of doing meetings, so I don't know if you want to take it section by section or if we just want to open it up to members for observations in the first instance.
We do section by section, please.
Okay. So section 1 was the background that we were outlining our approach to antisocial behaviour at the council. Our legal definition that we follow and some of the types of antisocial behaviour that you might see or you might experience or you might have reported through from your constituents. We also introduced there the legislation that we use under the Antisocial Behaviour Crime and Policing Act 2014 and also the tools, a brief introduction there to the tools that we would use to take forward our enforcement activity. Officers from the partnership team are tasked with antisocial behaviour enforcement activity. So the team's led by myself, who I've met many of you before, and Natalie Noon, who camera's off at the moment, but I'll bring in a moment. Many of you have had dealings, conversations and advice actually from Natalie over the years. Natalie and Sarah Finn are the officers that you will deal with on a daily basis that are picking up complaints from members of the public and also concerns that are raised by you individually as members. Section 1 in the background just covers as well that there is a crossover between what the partnerships team do and also what the Environmental Health Service do. So very often you will perhaps come to us with a query and there might be some sort of overlap, but we generally work that one through with you and for you as the customer. We get support, of course, from the legal service, legal team, invaluable support really, particularly when we need to progress any enforcement activity. And we don't do it on our own, we do it with a variety of partners. As you know, many of you from dealings with us previously, we do work really closely with the police. social care, and then many of the other partners out there in the community and voluntary sector as well. And we've just also outlined for you there some of the formal mechanisms that we've got in place and some of those formal associated activities, such as the Joint Operations Group and the Antisocial Behaviour Case Conference that we've been running for many years with quite a lot of success. And then linked to that, actually, although not explicitly on a day-to-day basis, is the work of the Vulnerability Hub, because again, there are very often crossovers we do find in some of this work moving forward. So moving on to local demand and snapshot, which is section 2, page 10 of your report pack. We've outlined there the total number of new antisocial behaviour cases that were received in the period 2020-2021, which was 461 for the period. That was an increase of 26% when we compared it to the previous financial year. We've also broken down some of the enforcement activity for you there under section 2.2. You'll see the variety of community protection warnings, notices and fixed penalty notices, which is the sort of the escalation route, if you like, for enforcement activity within our powers. 2.3, we're just outlining there the number of young people that were referred through to the Early Intervention Case Conference, and we can talk in more detail around that. And then 2.4 there, we're outlining the number of antisocial behaviour complaints, as Councillor Heeson just said there, by LAP area. And the reason we've done it with LAP area, it just seemed more sensible and something that folk were familiar with. We probably will be changing that moving forward, and I think we'll be probably reporting that for you in future by county area, ward area, because there are so many, might be a bit insignificant in terms of the figures. So we thought we'd, try and find a natural sort of grouping for the areas. We've also broken down the number of antisocial behaviour complaints by type. So what's probably important to stress here is this is the type of complaint as considered by the complainant. So for example, a general nuisance complaint might not actually end up being a nuisance outcome, but it would be perceived by the complainant to be a nuisance at the time of reporting. So that's just something sort of to bear in mind when we're having the conversation following the introduction to the report. Let me see now, local arrangements. So section 3, we're over on to page 12 for you of the report. Local arrangements, we're talking about here the complexity really around antisocial behaviour, something that often presents very simplistically. Once we find out more information and once we start to unpick the problem, often turns to be something slightly more complicated, and there are always, of course, two sides to a story. We have had very many examples whereby something that's presented as antisocial behaviour actually has become a safeguarding issue or a domestic violence issue, something like that. So just, again, something to bear in mind as the conversation pursues. We do have, we think, an effective case management system in place. We've worked for many years on refining this case management system, and we've got a computerized case management system for all of our recording as well, which is really helpful for us. We make sure that we undertake risk assessments for each case that comes forward to make sure that we are safeguarding victims and also complainants. And we create an action plan for responding to each case of reported antisocial behaviour during the investigation. It's fair to say. 3.5 there, we're just outlining some of the tools that we might use to respond to complaints of antisocial behaviour and the lower level incidents in particular, such as the diversionary activities that we would do with partners for provision of activities for young people. Community resolutions and mediation, that's something that we would try to use to informally address perhaps lower level neighbour nuisance complaints. Target hardening and safer by design tactics is something we've had some quite success with over the years. Smaller projects with, it might be gating schemes or CCTV most recently. There's been lots of project examples that we can throw out there for you. We've also done quite a lot of work, and this is where Natalie's really pulled the service into its own really, and we've enjoyed quite a lot of attention from some of the other areas as well, some of the other district areas, particularly with the work with families and young people with verbal and written warnings, acceptable behaviour contracts, that sort of thing. And more recently, following the antisocial behaviour bill, the community protection warnings and the community protection notices. Then we talk about the formal route for addressing incidents of antisocial behaviour. So that talks about civil injunctions, criminal behaviour orders, community protection notices, etc. there, and closure orders, all the way through to closure orders. Over onto page 13, what we've tried to highlight there for you is further issues for consideration. So some of the challenges really that we've faced over the last 12 years, which was one of the points I think I took away from the meeting last time. First one there was the effects of COVID. Obviously, our numbers have changed. I think it's fair to say. I think the reporting has changed in terms of customers coming forward and some of the issues we've had. Obviously, we've not had before COVID breaches, for example. So you'll recall in lockdown, there were restrictions put on place to visitors to property and that sort of thing. So this is something else that we have picked up over the last 12 months that we've not had exposure to before, and we've had to pull together a sensible policy to respond to some of those concerns and complaints. And again, we've worked really closely with our police partners on that. We did, of course, over the last 12 months as well, and I think we've put it there on the report, we had a decrease in the what we would call the ordinary antisocial behaviour complaints. And some of that was because there were fewer people congregating in outdoor spaces. So, there's some obvious sort of changes that you might perhaps expect. We've ensured during the pandemic that there were support in place for vulnerable residents. And again, this has, we've been very acutely aware of this over the pandemic. And we've made sure that our partner links have been really effective to ensure that we could reach out to folk to give them additional support as they've needed it. And I think I said to you in previous reports, we've worked really closely with the charity Realise. So we've done some work around social isolation and loneliness, and also with a lot of the other community groups, and there've been a phenomenal amount of resource that's come into fruition from the voluntary sector as well. So we try to work really closely with them where we've been able to. Then we've talked about the delivery of diversionary activities for you, because that's something that we've had to put on the back burner over the last 12 months. But we do have a number of plans in place to look at stepping that up over the coming months, particularly over the summer season. We've got plans, Natalie will tell you more in a sec, but there's plans in place for a reinvigorated space scheme for this year for Newcastle. And we're also trying to tie that into some of the activity that the County Council are running with the holiday activity scheme and the holiday activity fund. So there are quite a few opportunities, and we're looking at maximising those really where possible. We were also working with schools. Sorry, I missed those as well with the introduction there, because the schools are keen to step up as well and ensure that there are some sort of provision in place, particularly for kids from vulnerable families. Another project that we've delivered over the last 12 months is the mobilisation of the new CCTV system in the town centre, something we're really proud of. We've been working on that for a number of years, but it's taken a little while to get our ducks in a row and get the funding in place to be able to support that, something that we are really proud of. And we are looking at some further enhancements to that with some opportunities that have presented themselves through the Town Deal Fund. We then move on to talk to you about substance misuse, mental health, homelessness and antisocial behaviour, bit of a mouthful. But as we've said in the last couple of reports that have come through to you, there's a real fine line between some of the work that we've been doing around the perceptions of safety and antisocial behaviour in the town, and some of the problems that we've encountered with rough sleepers in the town as well. So where possible, as we've said to you before, we will offer support, but where there are issues that are affecting other town centre users and where we've got street drinking or aggressive behaviour, then we are looking at working very closely with our police partners and others to make sure that we are undertaking appropriate enforcement activity. And the report then talks about the legal and statutory implications. So as again, it goes back to the Antisocial Behaviour Crime and Policing Act, as we've said. So I think I'm hoping that gives an overview of the report, but would anybody like to pick up any questions at this point before we delve into things a little bit deeper? Natalie, if I
Has anybody got any questions? Right, Councillor Fox-Hewitt, please.
Thank you, Chair. Good evening, everyone. Given the 26% increase, I know from my own ward, there's a lot of complaints around when it's reported through the social media forums, etc., that there's quite long delays in getting a response, if any. Alongside the fact that we've had great difficulty in running diversionary activities because of COVID, are there any plans to increase visible patrols through partnerships and such as local policing teams?
Councillor Fox-Hewitt, sorry,
Yes, that's correct.
Oh, sorry, I've got a little bit of a cloudy screen. I can't see people's faces, so apologies. I could hear your voice. I think I recognised your voice. In short, the answer is yes, and I'll bring Natalie in just a sec on this one. It's a difficult one though, because some of the social media from the council's perspective, and this is where we kind of have to just sort of put it out there. There's two sort of directions of travel for reporting an ASB complaint, and it will depend on where the customer goes, where the resident goes. So a police response, we can't really react to that. We can't give you the correct response, and our service is only Monday to Friday 9 to 5. So we do work really closely with the police and make sure that we provide a timely response, but our timely response is 3 working days. In terms of responses, I'm working with the police. Natalie is constantly coordinating our collective response. The police are our eyes and ears on the patch, and we do rely quite heavily on them, but it's only as good, I suppose, as the reporting that comes through. So unfortunately, what I would always say is, while the social media reporting is really helpful, unless it's the official police social media, it's probably not going to attract an immediate response. And of course, if it's not an emergency, it will be prioritised. And again, that's not something that we can really respond to. Nat, do you want to come in here just to give a bit of an overview of the way that we work together with the police and respond to these sorts of complaints?
Yeah. Hello, evening all. I hope everybody can hear me okay. Yeah, thank you for that, Sarah. And just to add, as a response to the question, we do work daily with the police in relation to looking at areas and hotspots of concern where there's antisocial behaviour issues. And as a result of that, what we would look to do is look at putting targeted police operations in conjunction with other partners as well, around specific areas where we know that that we've got concerns and that have been reported through from members of the public. And a lot of the time that information will come directly from members of the public contacting the council and contacting the police. And ultimately, when we look at statistics of how many complaints we've had for certain areas, and that can accrue interventions such as heightened police patrols, signage, working with our housing providers, working with other outreach services dependent on the specific issues that may be at hand, working with local schools if the concern is in relation to younger individuals. So it's very much bespoke to the complaints that come in, really. So regards reporting, I would always urge residents to report anything through. Obviously, if it's an emergency, it would be to the police 999, but also to report it via 101. And ultimately that can be done through the police Facebook as well. And that information is ultimately liaised on every day when the complaints come through as antisocial behaviour, and it may be something that the local authority needs to intervene with. And then we would look at planning together, along with lots of other partners, a targeted response, really. Thank you.
Yeah, thank you, Madam Chair. In relation to the number of ASB cases that are received, are they received by any particular body like the police or the council or combined or what? Because especially in my rural ward, in Newcastle rural, people are totally fed up with total lack of police coverage, and they often don't bother phoning because they can't get any response.
You want me to come in there?
just from an operational perspective, the complaints that have been highlighted within this report have come directly from the complainant, so directly from residents.
Just to add to that, Councillor Panter, these are reports to the council, not to the police as well. So yeah, these are the ones that come directly through to the partnerships team. What I would say as well, often we do hear reports of hotspot locations and residents that, you know, are unhappy with the situation locally, but they're not reporting it through. And I go back and support really what Natalie said earlier. I'd urge anybody that's experiencing anything untoward just to get in touch with us, because there's often lots we can do, but the more reports we have, the more chance we have at dedicating some resource. And it might not necessarily be our resource, but it gives us a better argument to try and encourage a police resource over to that area as well. So please, if that's just one message that you guys take away from today, if you can just encourage reporting, we'd be really grateful.
Thank you.
Councillor John Cooper.
I believe somebody's before me, but mine's a simple question. Aspire Housing installing cameras, are they linked into our system?
Not at the moment, Councillor Cooper, no. We have had some conversations with them about exploring the opportunities of us working closer together. But as you appreciate, because we're two different organisations as well, there's the data protection legislation that we do need to take into account. Aspire are looking at their investment though, as we've said, so where we can look at joint working opportunities, we absolutely will. And I don't know if you're aware of this, we've recently commissioned our CCTV service with Stoke City Council, and other local partners are also having conversations with Stoke City Council as to how their services might be delivered for them. But obviously with everything, it would involve, I would guess, a procurement process. Thank you.
Anybody else got any questions? Councillor Proctor, please.
Thank you, Chair. Yes, Sarah, I mean, I accept that there's a big difference between the figures here from you, which are reported to the council, compared with the type of problem that's going on out there that doesn't come to you but goes to the police. And I think we need to be clear that the criticism around the patch isn't about what happens to the complaints to the council. I think the complaint from the public is very much the response by the police to complaints of antisocial behaviour. And that's where the breakdown is coming from. I haven't got any problem on my patch with the council's response, but I've certainly got lots of problems concerning the lack of response from the police. People ring up and they're given a number and told it's not urgent and nobody ever turns up. So let's be clear, the problem out there isn't with your service, it's the other service. Thank you.
Kieran.
Thank you, Chair. And thanks to Sarah and Natalie for the overview. That was really helpful. A couple of questions. Firstly, there's a reference in 4.14 to the fact that a number of repeat offenders, so to speak, have been excluded from particular areas in the borough, most notably the town centre. I suspect I'm not the only councillor who's been told by people who use those areas that there are people who've been excluded who are essentially flouting those exclusions. So my first question is, how are those exclusions being policed with a small p? And then my second question is about space. There is always this issue that the more lead-in time there is to the organisation of space, the better the offer over the summer. So we're in June, and we're also in a period of uncertainty about COVID. So is there a risk that space, as we kind of know it and understand it, might not actually go ahead this summer? And if so, is there a plan B in terms of activities for young people?
Thank you. Okay, I'm going to do question 2 first, if that's okay, which is a bit unconventional, but it's just fresh in my mind what you've just asked, Councillor Kieran, so thank you. I'm going to bring Nat in, but what I will say before Nat starts talking is just from my perspective, how impressed I've been as a service manager around the plans for space this year, because I've got to say, probably had a few reservations myself around how this might pan out, but the partners have been rallying around and these conversations have been happening now for a couple of months. And we've been pretty impressed actually with some of the plans that are in place. So at this stage, I'm going to stop waffling and I'm going to ask Nat just to come in, because I know that Nat has been leading the conversations with a lot of the partners over the last few months. So Nat, if I can just ask you to give a quick overview, please, of where we're up to.
Yeah, hello, thank you for the question, Councillor Kieran. As Sarah's just highlighted, jumping to question 2 around space. I can advise that we are going to be introducing space diversionary scheme for 2021. It has all been agreed quite recently between us and other partners. Funding has been secured. Certain locations have been discussed in relation to external partners providing outreach within certain areas of our district. And also we have committed to providing quite a few passes for Jubilee 2 to individuals this time from the age of 8 upwards. And it's going to be focused around not just the individuals themselves, but around their families. And we're going to be providing the gym passes at a reduced cost of £5 for individuals young individuals within Newcastle under Lyme, to ultimately, provide them with some diversionary activities that they can undertake throughout the summer period. We're also in conversations to try and extend that, not from just the general 6-7 weeks holidays of summer, but also to other half terms as well. So we're currently working on the publicity around that, and I am hoping that will be out within the next couple of weeks. Conversations are going ahead this week after half term, was obviously last week, with the schools as well, and we're going to look to be launching Space 2021. So that's really positive. Obviously we've had to ensure that we're compliant with COVID regulations. So there's current policies and procedures around all of that stand with Jubilee 2 for the gym passes. But ultimately we're working with providers themselves who ultimately provide the diversionary activities within locations to ensure that they are compliant as well with COVID regulations. And we're currently in the process of doing risk assessments within certain parks within the Newcastle Borough, where we are hoping that we may be able to put some of these diversionary activities.
Perhaps just to chip in as well, what we have to paid attention to as well is some of our hotspot locations. So as in previous years, we've tried to take note of where we know we've got high incidence of activity, large numbers of young people congregating, and we've tried to work with partners to plug some of those gaps. So we know we're never going to have a perfect piece, but at the same time, I think we can all be pretty proud of what we've achieved so far with space this year, and I do genuinely think as well that we've picked up the conversations far earlier in the year than we've done previously, because it has been a bit lastminute.com in previous years, whereas we've really considered our approach this time. So I hope that answers question 2, Councillor Kieran.
Yes, it does. Thanks.
Would you mind just reminding me of question 1 so I don't miss anything, please?
Got one little comment. It backs up Bert, actually. In my ward, we've got an issue which has been going on now, and Trevor Johnson has had email after email and problems with it now for the last X amount of years. I'm getting it now. Well, I was getting it then, but I'm getting it now. Now, the police are coming round at 10:30 in the morning when the youths are at school. So they're not going to be giving us any problems. But they're saying they're coming round. They'll do us little trips and they'll come round and keep an eye on things. But they're coming round at the wrong time.
It's a difficult one to answer, not knowing the details, Councillor Cooper, but is this one that we can maybe pick up outside of the meeting? We'll have a conversation and see if we can unpick it a little bit.
Yep, please.
All right, if you perhaps have a conversation with Nat and I when you get a chance, perhaps tomorrow, and
Okay.
we'll pick that one up and we'll unpick it a little bit and just see if there's anything else that can be done.
Yeah, because we're just going down in circles.
Yeah, no, I appreciate your frustration. I do.
Okay, thank you very much. Councillor Kieran.
Councillor Kieran.
Yeah, sorry, I was just nudging the conversation back to the answer to question 1 that I asked about the exclusion of individuals from locations in the borough, and what's actually being done to make sure that those exclusions are enforced and respected by the individuals.
Okay, so yeah, thank you for that. Thank you for reminding me of the question as well. The exclusions that we've been using to date have been police power exclusions. So they're generally for a limited time, 24, 48 hours. And the police are our eyes and ears, as we've explained, to enforce that for us. However, we are getting a little bit more creative with the way, and not creative in a bad way, creative in a good way, with how that we are using some of our ASB powers. So we've got the police powers that I've just mentioned. We've also got our community protection warnings and notices. And we are looking at other enforcement activity. And that will chip in at any time now because she'll tell me off for telling you the wrong answer. But what I would like to do is try and give you some reassurance that we are trying to up the ante with some of the enforcement activity. You'll be aware that some of our powers, our civil powers, are quite mild, and what we need to do is to be able to escalate them with certain individuals. Our powers don't come with particularly high penalties that are going to be putting people who persistently behave in an antisocial way off what they're doing. But as we work through the powers, we can escalate through to the next power and the next phase. And this is where I think I will hand over to Nat, because Nat, I know, has got an active caseload of individuals that have been reported where we've exhausted some of the lower level powers and they are now progressing to higher. Nat, do you want to come in at this point?
I can do.
Okay, cool.
The legislation and the powers that the Borough Council utilise at the moment in relation to antisocial behaviour concern is the community protection legislation. So that's basically a progressed enforcement route. So warnings get issued, notices get issued, fixed penalties get issued if individuals have ultimately got an income or on benefits, and prosecutions can also be progressed. So the test for that is ultimately an individual that is persistently having a detrimental impact on the quality of life of others living within a community. So certain individuals that persistently engage in unacceptable behaviour, that don't engage in support and don't take up opportunities of change, then the Borough Council takes a perspective that ultimately we have a responsibility to ensure that members of the public's life are ultimately, you know, not detrimented. So we try to work on balance with support and enforcement, but as you can see from the report, we have had to issue quite a few community protection warnings. And yes, you're right, some individuals have ultimately not adhered to those. Now, they will have had bespoke conditions put in place for wherever their behaviour is being perpetrated or whatever it is that, you know, that they are involved with, that ultimately they have to adhere to prevent a notice being served. So if they are excluded from certain areas where they're persistently engaging in antisocial behaviour, then they'll get issued with a notice, which is a legally binding notice, which they have a right to appeal. And if they breach that notice, then ultimately we can issue them with a fixed penalty notice. But we can also look at going to court for prosecutions, and we are currently, it's fair to say at the moment, at that within that process. Alongside that is not just the work that's been done with the Borough Council regarding the exclusions and the court action. We're also running coincidentally with some police enforcement as well, regarding criminal activity and convictions, and also some criminal behaviour orders. We're also running alongside with our housing providers. So some individuals that might be causing issues, we know that, for example, at the moment, we've got some living, within Aspire properties that ultimately, or visiting properties that ultimately we will work with our housing providers on, and then there will be tenancy enforcement also. So we will do what we can from a local authority's perspective, but it will always work best when it's worked proactively with the other agencies. And that's very much from a people perspective, but we look at the place element as well. So the whole contextualized element regards particular areas of concern and what interventions can we put in place logistically, really, from perhaps a structural element and different initiatives. So Sarah, you mentioned the CCTV. So we're currently engaging, at the moment, we are looking at CCTV, and this is imminent work, all of this, well, the predominant feed-in subways to Newcastle under Lyme, town centre. We are looking at putting gates up at certain locations. We've got certain structural buildings that have ultimately been brought down. So there's certain areas that we would look at to try and help matters of perhaps congregations and certain areas that cause our complainants masses of concern, really.
And I think just to add to that, Councillor Kieran, as well, while we haven't sometimes got the immediate response and the immediate resource to deal with a particular problem at that moment in time, I think persistence for us has been key. Because while we've alluded to some of our powers are sort of softer civil powers, once we've exhausted them, we can progress them through to the criminal route. And we've got a number now, haven't we, that are going down the CBO and injunction route at the moment. Again, unfortunately, that's stuff that folk don't see because it's work that's happening behind the scenes. But again, it's us trying to be as persistent as we possibly can. But some of that action is taking some time to come into fruition. Does that answer your question, or is there anything from there that you want to probe a bit further with?
No, that's really useful. Thanks, Sarah and Natalie. I suppose one observation I'd make is if there is an issue about the enforcement activity the council's taking not really being in the public eye, maybe one response is to actually increase the information going out to the public. I mean, particularly, one of the reasons I asked that first question was as a result of a conversation with someone who owns a business in the town centre, and they're not aware of the fact that the council are taking action against repeat offenders.
Yeah.
They just think that individuals are being issued with an exclusion and then are just completely flaunting it with apparently no consequences. Yeah. So it might be useful if they were made aware that there are consequences and the council is taking action with its partners.
Definitely, and thank you for that. And it's something that we've talked about and mooted as a team many times. I think sometimes it's the sensitivity of some of the information that we'd be going out with. But what I would be really happy to do is if you've got examples of folk that don't feel they're in the loop, pass on the details to us and we'll make contact with them. We'll go and visit them, actually. We've done that very many times. A lot of the businesses in town we've got links with already, but we appreciate, we haven't been able to get around everybody. And we're more than happy to have those conversations with folk. And it's sometimes easier on a one-to-one basis when folk can understand where we're coming from and some of the work that we've been doing. But I'll be honest, I'm not a fan of putting out blanket messages because I think they can get misconstrued quite easily. I do think that's a rather difficult route, whereas, if we can go out and do some work with some of the businesses individually, encourage that reporting. I mean, we've been doing some stuff with the markets in the town centre over the last few weeks as well. And I know the bid have been really helpful with the street ambassadors going out and making some of those links for us, because, you know, there's only a limited number of us at the council, Sarah and Nat. But it's been helpful that we've had other partners on board that are able to field some of that information, bring it through, and then feedback some of the activity that we've been doing. But absolutely take on board that we, you know, your point that we haven't gotten it out to everybody and there's more that we could do. So thank you.
I've got 3 more councillors to ask questions. Councillor Hewitt, can I ask you to let me take the other 2 councillors first before. Okay, Councillor Holland, please.
Thank you, Chair, and welcome to the new portfolio holder who is in her place. Congratulations to Councillor Heesom on her appointment. Officers have mentioned already the enhanced CCTV in the town centre. It's been a little while since that went live, and I commend the investment in that, both by this authority and by the bid. Congratulations to the bid on securing their renewal ballot earlier in the year. And we've heard a little bit from officers about where that money that's being raised from local businesses is going. But what assessment has this authority made of the improved CCTV and the monitoring contract that was awarded to a councillor, to a council relatively close to here? What results is that generating? Is it generally effective, do we feel? Is it helping? Is it delivering the results that we need? And are our partners, i.e. the police, finding that useful?
Thank you. I think it's early days, and I think that's probably the point I'd just park straight away. It's early days. It's been operational since the beginning of the financial year, so we've not had a full quarter of monitoring statistics to start pouring through, and that's where I get a bit geeky really, and I like to have a little look through and to see, you know, some of the reporting, some of the things that we've asked them to record for us. But what I can comment on, and again I'll bring that in at this point, is the general feeling, and the general feeling is that it's improved, that we've got more visibility around our town, that we can task. The police have also got eyes and ears through their own sort of access to the system, so that has pleased them immensely. It helps with their Safer Nights operations as well, and I think that in itself has been helpful to us. There were some blind spots in the old system, and we're never going to get every single blind spot in the town centre, but it's a vastly improved system, and feedback from partners has been really positive all round. I'm trying to think of anything negative to sort of throw in there. I think Nat's already mentioned around the additional enhancements that we've looked to. Nat, do you want to add anything?
I'll just add in that obviously we've got quite a large area of the Newcastle town centre CCTV'd at the moment, and operationally, yeah, it's working in my opinion very well. I have meetings daily with the police, and at least once a week we will be discussing certain incidences whereby we've managed to, you know, that where the CCTV has been beneficial really. It obviously helps us in relation to not just identifying trends and hotspot locations, but how the system is now. It's rather than incidences being dealt with retrospectively, so there's been an incident, then you need to review the CCTV. Everything is done in live real time, so it's monitored 24/7 by operatives up at the work for Stoke City Council, but also they are linked into our local policing team's radio system, so when they see something ongoing, it is just a radio through to the police and ultimately they can be acted on. We've also given the police full access as well within our building at Castle House, so it works operationally very well. And I would also say the fact that ultimately we've now got a CCTV system that moves between Newcastle town centre through towards Stoke is really beneficial for us, because there is such a large crossover of individuals that ultimately cause problems within Newcastle, but then will inadvertently cause problems within Stoke. And as much as there are local authority boundaries, a lot of people don't ultimately see them. So practically and operationally, does work very well, in my opinion.
Thank you.
Thank you.
Okay. Councillor Jill Waring.
Thank you, Chair, and thank you, Sarah and Natalie, for the information, and welcome, Jill. My question about CCTV. I know that a lot of officers' time has gone into helping Kisgrove Town Council in supporting the installation of CCTV in the town there. Has any progress been made? I've not heard anything for a while.
To be honest, we've been waiting to hear from Kidsgrove. So yeah, I think we've given them, I think it's fair to say, Nat, correct me if I'm wrong, I think we've given them all the information we possibly can. And I think we've kind of left it with them to let us know when they need us. But yeah, no, I haven't got any further updates, I'm afraid. Councillor Waring.
Just one more question. Can I ask when you had the last interaction with them then?
Nat, I'm looking at you now.
Without having the date in front of me, it's difficult to say, but it's months ago.
A couple of months, isn't it?
Yeah. So yeah, lots of information was provided, and the offer of ultimately, you know, some further support and guidance is there.
Yeah.
Councillor Fox. Is that Councillor Fox?
Thanks, Chair. Like Councillor Julie Cooper stated, I think the concerns do centre around the service response that's out of hours. In my own ward, I know on Inglewood Drive at night, there's been numerous reports and complaints of antisocial behaviour, but as has been said, the police response is not forthcoming when that's raised through the 101 number or the social media platforms. Additionally, I know on Saturday, daytime in the town centre, the weekend just gone, there was lots of people out, and there was a group of up to 15 people that it was alleged by a lot of people that they were high on substances such as monkey dust. They were fighting, and it took more than 25 minutes to get a police response. Now, as Councillor Proctor says, I think the concerns are around the policing response and the provisions. So not only does that blight the life of residents in all our wards, but it's now going to impact on the plans for the town centre and the rejuvenation of high streets. So that being said, is it not something that we could look to formulate as a council a business plan to the Commissioner's office to try and get a policing response back in Newcastle Borough?
I think, in all honesty, I think it's a difficult one as us as officers to answer. And I think you're right with what you've said there around this is one that would need to be escalated through to the Commissioner's office. I think it's probably something we should take as an aside and speak to the LPT commander about in the first instance. But I think if it is that we're not getting the answers as you'd expect, it may be one to escalate as an inquiry through to the Police and Fire Commissioner.
Questions before we move on? Councillor Holland.
It may be valuable to raise it under the work programme, but we've had a suggestion that we might like to make some inquiries with the Police Commissioner. I think that's an excellent idea. We've got a new Police Commissioner for Staffordshire, and we absolutely should invite him to come to a future meeting of this committee to talk about the way in which our authority interacts with his office. It may also be helpful. I know the police attend, where possible, the Locality Action Partnership meetings, but if the committee felt it helpful and if the police had useful answers to give, it would also be a good idea, in my view, for us to invite a representative of the local policing teams to come and talk to us in conjunction with our officers, and then we have an opportunity to ask questions directly of those people who are able to make decisions on these things. Thank you, Chair.
Second that one. Thank you. Any more comments on this topic before we move on to the next part of the agenda? Okay. I'd just like to say, before I pass on to the green space to Andrew, I'd just like to say thank you very much for Councillor Moffat, Holland and Burgess for being on this working party with me and what we've come up with. So just like to say thank you very much for the time we've put in. Right, Andrew. Roger.
Yes, thank you, Chair. I was going to say, I think this one's for me. Well, as you know, Chair, you chaired the working group that was set up by this parent committee to look at the issue of trying to encourage greater use of parks and open spaces to benefit people's mental health and physical well-being as well. And I think the recent, well, the ongoing pandemic has really highlighted, the value and the benefit that our communities derive from having free access to parks and open spaces across the borough. The group wanted to look into sort of three main topic areas, which were in section 1 of the report: what's the current level of use of parks and open spaces? Are there any barriers to use, and what are they? And what knowledge is there among residents of the open spaces in their area? And how is this promoted and publicised? And is this promotion and publicity effective? So they were the sort of three areas that the working group looked at. There was a series of meetings and reports which sort of delved into this in quite some depth. This very short report kind of belies the depth of discussion and conversations that were had by the working group. But it was distilled into the 4 points that are in section 2 of your report. And these are the things that the working group decided they wanted to recommend to the parent committee tonight. So number 1 was the recommendation that the importance of open spaces for physical and mental health and well-being is emphasised and given appropriate priority in the council's annual budget setting programme, and also the One Council programme in relation to digital promotion of the Parks and Open Spaces service and how customers engage with it. Number 2 was a recommendation that some initial pilot work is undertaken to improve information on open spaces on the website. It's fairly limited at the moment, and just doing some basic things like a register of strategic open spaces and location maps, and potentially using trialing some QR codes at 2 of the bigger sites, Lyme Valley and Bathpole Park, which would enable users to upload feedback and interact with some information on the website. We talked about resources being needed to be made available for this work, and I think we're gonna try and make that happen over the course of this year. And we also want to look at the report it functions on the website via the One Council programme. So again, customers can interact better and at their first attempt when they're using the website. Number 3, there was a bit of discussion around tree planting and how important that is. Right tree in right place, and the environmental sustainability strategy has picked up on that theme. And what the working group wanted to do was encourage community involvement in this as much as possible. We looked at ideas around the potential sponsor a tree initiative. Could be something like, could the community plant 850 trees over the next couple of years in the lead up to the borough's 850th anniversary. A lot of this sort of stuff already goes on in Britain in Bloom's community project, so we can continue to push that forward under that banner. And also, maybe it's now timely to review the council's urban forest strategy, which was published in 2013 and updated in the light of all the recent climate change agenda and other environmental initiatives that are ongoing. So the group were keen to push that. And number 4, the last one, was just to have a look and a review at how we access external funding and what partnership activity goes on. As things have got tighter over the last few years, there's maybe a little bit less grant funding available directly to councils, but maybe a bit more that's available to community volunteer groups, for instance. So we need to, a lot of this work is already going on and has been going on for a number of years, but there might be, again, some benefit in reviewing where we are with that and again, prioritising, where do we want to focus our efforts into trying to work with communities to deliver community projects along that line. So, as I say, a very good piece of work by the working party. It's concluded now for the time being with these 4 recommendations, which the working party are putting to the parent committee tonight. Thank you very much.
Thank you very much, Roger. Has anybody got any questions? Councillor Holland.
Thank you, Chair, and thank you for the work of the working group, which I was very happy to be a member, but which was steered by others very capably. And thanks to our officers for their input and for forming this report. I think those bullet points in section 2 are bullet points that we would like to put forward to this committee, and if this committee is happy with them, the working group would like then for Cabinet to respond to that. So if Cabinet are able to include that in their update to our next meeting, that would be fantastic. I know a lot of what's been recommended is already something that is it forms part of the very successful and very well-run Britain in Bloom programme that this council has. Some of it requires modest additional resource, so it will be up to Cabinet to decide whether or not to apply that resource to this. But on the whole, what we discovered as a working group was that green spaces within our borough are extremely well used, our parks are much loved, and our job as an authority is to maintain the offering that we've got and to burnish it and to gild it in any way that's possible. And these were the modest proposals that we came up with. They're by no means exclusive, but I don't know if you, Chair, had any reflection on that before we pass it on to Cabinet, I hope.
I've just got one comment on that. I was more into marketing as well, which I have noticed it hasn't come on this report so much as the marketing to make it known to people that we have got the open spaces and they can come in here and apply for notices and things like that. That's another thing I was trying to push for the public as well, which I haven't noticed in this report. Councillor Panther, please.
Thank you, Chair. My comment is in relation to item 7, quality impact assessment. And it says quality issues will be considered as part of any work which is taken forward. I've taken this is particularly refers to those that are physically disabled in particular.
Shall I come back on that, Chair?
Yes, certainly.
Yeah, thanks, Councillor Panther. Obviously physical disability is one potential barrier to access that we need to consider when we're providing services in parks and open spaces, whether that be new facilities or just managing the existing ones. But other barriers can be language, there can be sight impairment, there can be mobility impairment, there can be cultural. So there's a range of different things that we need to be aware of. And just going back to Councillor Cooper's point about marketing, it's maybe not explicit in the recommendations, Councillor Cooper, but it's certainly implicit in there around the customer engagement through the One Council programme and improving our website so that it is more accessible to people, with a whole range of potential needs on there. So I think that the access barriers and the marketing, in my mind, a lot of that work will be done through the One Council project, the improvements to the website, the One Front Door, all of these things that we're going to hope to make our services more accessible to our communities through.
Councillor Proctor, please.
Yes, Chair. I mean, I'd like to commend the group for the work that's been carried out here with the officers. And I have no hesitation in saying that we as a group should forward this immediately to Cabinet for it to be enacted, and let's have some response back to this committee. But as it is, I think that the report says it all and should be forwarded through to Cabinet.
Thank you very much. Does everybody agree with that? Councillor Fox-Hewitt, if you want to comment.
Yes, thank you, Chair. Likewise, I fully support the work done on this report. It's very good. But I would just ask that this work isn't done in silo, because the issue of green spaces was recently put before the Finance, Assets and Scrutiny Committee. This report would have been very beneficial in that debate. It does seem at odds with the Council's position advanced at that committee. And I would ask that this report is now considered by Cabinet alongside those issues. Thank you.
And I'd just also like to point out that I did mention that one does not fit all, one size does not fit everywhere. So if we come up across anything, You know, you can't just say the whole project goes in that area. One size does not fit everywhere. So just bearing that in mind when somebody decides, you know, they want to do such a thing. Thank you. So I take it that this group is going to send that this report over to Cabinet.
Yep.
Okay, thank you very much indeed. Thank you. I'm going to hand over to Andrew now for the health with CCG.
Okay, thank you, Chair. Yeah, the notes that were in your pack effectively are the notes of the meeting we have with Tracy Shewan from the CCG. Takes place on a quarterly basis. Really useful, to be honest, over the last 12 months. I'll just pick out some of the highlights effectively. Meeting was about 3 weeks ago, and I appreciate things have probably moved on somewhat, but effectively on that particular date, the 14th of May, the vaccine programme had hit the 1 million mark for Staffordshire for the first and second vaccines, with 93% of cohorts 1 to 9 having received at least one dose. So it's really a tremendous achievement. At that time, the next cohort of 38 to 39-year-olds were being moved to, and they will be offered the Pfizer and Moderna vaccine. In terms of things that have obviously moved on, Tracy advised the communities that had not been previously in touch with, such as the Bangladeshi and Pakistani communities. Again, there had been some positive movement there, that they had received 70% of the vaccine uptake, so it was moving in the right direction. And again, 86% of people with learning difficulties have been vaccinated, and a mobile vaccination unit had been out to fruit farms for immigrants, travelling communities and the homelessness. So really positive progress there. Councillor Cooper did ask about the Indian strain, and clearly over the last few weeks we've heard a lot more of that. At that time, there'd only been 4 people identified in one household, which was in Tamworth. Clearly that's moved on and is now starting to cause a little bit of concern. In terms of obviously the messages, it still remains the importance in terms of personal hygiene, in terms of hands, face, space, air. It still needs to be adhered to, as does social distancing. In terms of the hospital situation, that had massively improved from our meeting with Tracy 3 months before. So that 3 weeks ago, there were currently 12 COVID patients in the Royal Stoke, with only 1 in ITU. So you know, the numbers had come down considerably, which again is really good news. We spoke about boosters as we move through, and Tracy advised that you know, effectively that there's 4 phases of the vaccination programme in terms of tackling COVID. Phase 1, obviously, to vaccinate the adult population. Phase 2, to vaccinate secondary school children. And then phase 3, really, which is the starts to get to the real interesting bits, is to determine really if a booster would be required with the flu vaccine, either together or 7 days apart. And obviously research is currently ongoing with that. And again, whether it would need to be a full revaccination programme. And then obviously the last phase is to determine whether there is an ongoing need for vaccinations in years to come. Obviously, we all then went on to talk about the backlog of other cases in terms of obviously the pressure on hospitals and the medical service as a whole, and clearly that's had an impact on other areas. In terms of general practice, again, these were now open for face-to-face consultations, some being more open than others, to be fair. And again, there was a need that the public needed to be educated. Their GP may not always be the person that they need to see, for example, you know, a physio for a leg or back pain. Councillor Cooper referred to the bed shortage during the pandemic, and again, we were advised that surge capacity was catered for, but not being a need for any Nightingale hospital locally. However, the future did need to be thought about with possible surges modelled on the R numbers being at different levels. So that's a piece of work that needs to be obviously undertaken. And again, we just ended by asking again, was there anything that the council could do to help the health service in general? And again, it was really that we just keep pushing the messages about social distancing, making sure that people do take the vaccines. And again, that if we do know of any anti-vaccine groups, to try as best we can through our various measures to educate them.
Thank you very much, Andrew. I'd just like to add, I did one of my rapid tests today before I came out, and I rang my number in through to 119 and gave them my results. And I didn't know, I don't know who did, but you know in the little test kits you get in the little sample, that can, if that comes up positive, then you should go request a PCR to make sure that it is COVID, because that backs it up, because that other kit that we've got does every virus there is. So that could do the coronavirus, could be the flu virus. So it doesn't only do, well, I didn't know this until I had this discussion with 119 this afternoon. I don't know how many people did know. So I'm just mentioning it now that it is there, that could be, you know, it comes of anything. So if you do get positive on there, please ring up for the other test, just to clarify that you have got it, and then they know what strain you've got. Okay.
Thank you, Chair, and thank you for participating in the meeting, the minute of which is in front of us. I think, as our officer said, much of this is now out of date because of the passage of time, but it's a useful exercise to have been through, and it's great to know today that the position is even better than it was when you met. And that is a great success story. It's probably one of the few unqualified successes of the pandemic response in the United Kingdom. And I think it's fantastic that we're making such progress. So the one outcome that did seem relevant was when we, representatives of this authority, said, what can we do that would be supportive? The answer was continue to push the public health messaging, both about social distancing and about people getting their vaccine when they're eligible. Can I ask, are we doing that? Is the council doing those very worthy public communications?
Would you like to answer that?
I'll answer that if that's right, Chair. In terms of messages, the intranet and the internet still contain the COVID safe procedures, etc. And in terms of messages that are right on the street, we've still got the 2 metre distance signs. We're still visiting premises and businesses around how they're COVID secure in the opening up of the economy, etc. And environmental health colleagues are inundated with reports of failures of that type of procedure, which they're then following up. We've got COVID marshals across the borough that are, you know, making sure that we've got those messages out there, and we're going into retailers and businesses to make sure that they are operating in a COVID safe way. So yes, we are still doing it, and I think we'll probably have to do it for quite some time.
Thank you very much. Anybody got any more questions? No? Right. We'll go on to, I'm sorry we've got no minutes from the Health Staffordshire Select Committee, as I wasn't invited this time round. I don't know why. We'll move on to the work programme. Thank you. Thanks very much. Right. Oh, we have. Sorry about this. It's on page 23 of your bungle then, which is the COVID one from Staffordshire. Has everybody read it, or shall we go through it? And anybody want to ask questions? I don't know what I can answer, but let's hope. Okay, we'll just take it as noted. Thank you. Right, we'll work on to the work programme then, please. Denise? Councillor Kieran, if you'd like to say something.
Thank you, Chair. Have we moved on to discussion of the work programme? Yeah, I was slightly confused.
Well, while we wait to find out about the work programme, you can ask your question wherever it is.
Yeah. Okay, thank you. I'm just looking at the blank spaces in the work programme, and I'm working on the assumption we're going to have a discussion about things to put in those blank spaces. I mean, it seems to me that as we are the Health and Wellbeing Scrutiny Committee, it would make sense if we were to actually set some time aside to have a look at a fairly significant health and wellbeing issue for our residents, which is Wally's Quarry. So I would suggest that we might want to add that to our schedule. I'd even go so far as suggesting that we actually pencil that in for September and maybe move the Housing Advice Service report to a slightly later date. I'd suggest that we might want to invite the regional director of the Environment Agency. We might want to invite relevant people from the County Council and have a conversation with them about the situation in Wally's Quarry and try and pin down some of the issues around the potential impacts of the smell on health and well-being of our residents and try and dispel some of the discussion on social media, which is of mixed helpfulness. So yeah, I would suggest that if we're going to talk about what to add to the work programme, that we really should add the issue of the odour associated with Wally's Quarry.
Okay, thank you very much. The other problem is I'm not sure if somebody else is dealing with that with another scrutiny committee, because I don't want to do any cross parties if we're not going to start duplicating. So if we can do it and we can add it onto our programme, then very well. But if we can't, then I'll ask for advice.
Yeah, through you, Chair, let me take that away and come back to you and see what we can do, because you'll be aware that the EEP, Environment, Economy and Place Scrutiny Committee, did a comprehensive review and took back to full council a number of resolutions, and one of those was to keep a watching brief on the situation at Wally's Quarry. So, they may have anticipated it being a continuing work stream for that committee, although I do understand you're coming at it from a health focus in respect to this question. But let me take that away with my EMT colleagues and we'll see what we can bring back to this committee in the work plan for you.
Thanks, Chair. If I could just come back. Yeah, I do appreciate, and I'm no fan of the duplication of meetings, but this is a situation where I think we might want to look at this from every single possible angle. I mean, part of the remit of this committee is looking at issues around mental health, and it's increasingly clear that the odour is starting to generate mental health issues. There are businesses in the town centre complaining about the impact of the odour. Is this going to jeopardise our purple flag? Is it going to jeopardise a range of other issues that fall within the remit of this committee? And I would also just reiterate the issue that it seems to me it is a health and wellbeing issue if it's nothing else. And this is the Health and Wellbeing Scrutiny Committee. So it seems to me a bit of an oversight that we don't have a scheduled contribution to the discussion. I'm not suggesting that we trump or duplicate the activities of other committees. I'm suggesting that we augment and complement those activities from a health and wellbeing perspective.
Just add one thing, Councillor Kieran, first to this. I did ask, and I think Councillor Wilkes asked for this before the last Health Scrutiny Committee, and that was when we were told we would be duplicating it. But I think both of us did ask for it to go on our working party, if I remember rightly. And we were then told that it had been done, so otherwise it would have been mentioned then.
Yeah, thank you, Chair, for that that background information. But I would just re-emphasise, I mean, I think it's really important that we demonstrate to our residents that we're doing everything possible and everything within our power. And it seems to me, given that a lot of the discussion about the impact of this is around health and well-being, if there's no discernible action on the part of this committee that we can point to, that seems to be a fairly significant omission on our part as an authority.
Thank you, Chair. Further to Councillor Kieran's points, can we explore, as well as the very good suggestions that he's made, that we look to contact Public Health England and the clinical commissioning groups for a report on health issues that have been reported to GP practices, because I think that the situation is very unclear. Some appear to be putting reference numbers against symptoms, some appear to be not. And despite the assertion that there appears to be no long-term or unlikely to be any long-term health effects, I don't feel that that's based on any kind of evidence or study. And I think it's incumbent on us as a local authority to actually put that study in place.
Very much, Councillor Hewitt. Councillor Holland.
Thank you, Chair. I understand the frustration expressed by other members on this. It's an incredibly important topic, but I have to say that creating more opportunities for more discussion is not something that I support. I appreciate everybody would like this to come to their committee because everybody's got their own particular spin on the very great problem that this is with so many facets. But the time for talking about it is past. We are now at the time for action, and we as a committee, I'm sure, would like to see the administration take action. I understand that action is going to happen, concentrated much of it in the hands of the leader, who I know is personally leading on this issue because it's something that is of such critical importance to everybody in the borough. So having listened to our officers' advice, I would suggest that you, Chair, and the chair of this committee, when he's available, do seek further dialogue with other scrutiny chairs and with the administration as to the best way forward. But I could not foresee a circumstance in which it would be useful for this committee to meet distinctively and separately from all of the other activity that's going on in this council to tackle this dreadful issue and the awful company that is responsible for blighting the lives and the health of so many of our residents. Thank you, Chair.
Very much, Councillor Holland. Anybody else got any comment?
Thank you, Chair. I just want to reiterate what Councillor Kieran has said, that this is a Health and Wellbeing Scrutiny Committee. All of the things that I've seen, even as far as Audley, so not in the immediate vicinity of Red Industries Quarry, is that this is impacting in a massive way on people's mental health and well-being, and also massive concerns about the physical well-being, including erasing children needing to use inhalers, etc. So I personally, as a member of this committee, would feel that we were being really remiss if we didn't take a position on the health and well-being of our community members and the impact of Wally's Quarry. Thank you.
Councillor John Cooper.
Thank you, Chair. I'd like to an updated report on the air quality. We haven't had one for 12 months more now. Could that be possible later this year?
Would you like to answer that?
Yes, through you, Chair. I'm sure all of that can be arranged and put into the work programme, certainly on the air quality. Do you mean the air quality directive as opposed to a separate issue from the Wally's Quarry, or do you mean air quality? Yeah, okay. I'm sure that's not a problem. In relation to the specific health impacts about Wally's Quarry, we hear everything you say, members, and as I say, let me take that away discuss with the EMT colleagues, and we'll see, you know, what we're able to bring back to this committee for you. But I do hear your concerns loud and clear.
Chair, I'm concerned about the highways. It's truly a Portel Bank traffic emissions. That's affecting a number of areas in the borough. I would an update report on that. That's what I was asking for, please.
Through yes, Councillor Cooper, no problem.
Councillor Kieran.
Thank you, Chair. Yeah, I mean, I appreciate the points that Councillor Holland has made, and I think, as I already suggested, I'm not for a moment advocating unnecessary duplication. I do, however, think it would be useful. I mean, Councillor Cooper has quite rightly requested a report to this committee about air quality issues associated with traffic. So if this committee can consider feedback on one generator of problematic air quality issues, why can't it consider another significant generator of air quality issues in our borough? And I do actually think residents will not thank us if it appears that we had a chance to discuss these issues specifically from a health and well-being point of view, and that we passed up on that opportunity.
Saying, as I've said before, and I'll repeat it now, that Ian and myself have already asked for this to go before the last Health Scrutiny Committee. So we have asked to get it onto the work programme. So before you brought it up just tonight, it was suggested and we were just told no. So I can understand where you're coming from, because I felt so deeply about it as well, and I feel very partial, you know, very sorry for the people, the residents. I mean, I smell it where I live, and not only that, every time I put the radio on, I get the stink in Newcastle. You know, I don't want to hear that. But as we've said, it's already been done. So, you know, as Councillor Holland suggests, that we ought to get together the chairs and we'll see where we go from there. And then if it does open up that we can bring it back, then I suggest we do. But until then, I'm sorry. As far as I know, we can't put it on the work programme. Does that answer your question? Councillor Holland.
I wonder if perhaps the portfolio holders with us tonight have anything to contribute, seeing as we are here to scrutinise them.
You may have to wait for an answer, considering I've only been in post for a number of days.
I accept that freely. I think the chair is aware of the concerns of the committee about the compartmentalisation of how it is that we scrutinise what is being done. Can I move that we close the item on that basis?
Okay, have I got a seconder for that? Okay, it's closed and second. Thank you. That anybody want on the work programme, apart from the update of COVID, equality, what was the one that was burning? Oh, and antisocial behaviour. Yeah, if we could get somebody from, it's going to be a big one if we do the antisocial behaviour. If we get the police commissioner and back for an update on that. If you put those 3 items on the list. Does everybody agree? Okay, thank you. Got no urgent business. Has anybody got any that they'd like to raise? Okay. Well, I'd just like to say thank you very much. Thank you very much. If you could wipe your tables down and your chair down, and on your way out, and take all your papers with you. Thank you.